Okay, so the second half of the video on heel pain. Excuse me, calcaneal bursitis. Bursitis should always be an exclusionary diagnosis, even when you're seeing massive swelling right where the bursa is and it's tender to palpation, because this may be overlying more serious pathology beneath it. So there are tests you can do for bursa. The swelling and redness is specific to a bursa if it's right over the top of the bursa. But even so, you need to make an exclusionary diagnosis because of underlying stuff. So, what you'll get with this is, actually, we're talking about the subcutaneous bursa of the calcaneum. This interposes between the skin and subcutaneous fat and the fat pad itself. So this is very superficial. If it's swollen, you can see it, or you can palpate it. And palpation for tenderness is very superficial. It's right at the top and you can feel it. This is an inflammatory condition, so there's pain every time you take a step. There'll be less pain if you're wearing shoes with good heels and more pain if you're barefoot on a hard substrate versus a soft substrate. The pain may get worse gradually as you walk more and more and more, but this doesn't necessarily get worse from week to week. There are some conditions that will do that, but often it doesn't do that. It just gets bad and stays bad. Also remember that not all bursitis are painful, because they're probably not bursitis. But given that you're coming into this from having found it from the patient's complaints, this will be inflamed and painful if you see it, obviously. Squeezing the fat pad, squeezing it together should be negative, as should be the calcaneal squeeze test for fractures. Causes of this can be traumatic, straight down onto it, where you're running the biggest risk of underlying pathology, obviously. But microtrauma as well, with alterations of foot posture, cumulative stress from different shoes, different substrates, diseases such as rheumatoid arthritis, and infections must be considered always, simply because the heel is the first bit of your body that touches the ground when you're walking. So if there is a penetrating injury there, then it's going to be a prime candidate for infection. So look for redness, look for extreme tenderness, take the patient's temperature, and if any of this is coming up iffy, get it to the physician. Bone bruises also should also be considered as a exclusionary diagnosis. Get rid of everything else first. This is major trauma when you go as you come down fairly heavy on your shoe or you're onto a stone, but there's a lot of pressure at the time, either from the force of the impact or the smallness of the impact surface. So a fracture is always something to consider. There'll be pain with each step. Same thing again, if there's cushioning between the heel and the floor, it's less painful. Now, deep palpation is tender, so you have to dig in deep. This is going to be probably a smaller area because it probably is something sticking into the foot. So you're going to have to look for it and you're going to be digging in. So this isn't going to be easy to find. The fat pad and the calcaneal squeeze test both need to be negative for you to say this is a bone bruise. Even so, if you end up saying that this is a bone bruise, then probably it still needs to be excluded by an X-ray. Causes trauma, but remember there's underlying tissue, or overlying tissue rather, that's going to get hurt, the fat pad, and also obviously fractures of the bone. So just be aware that it isn't necessarily an isolated injury. Okay, so let's look at a process for looking at some of the information coming from the patient. This isn't for you to follow blindly. It's just to give you an idea of which way this information can go. But you do need some sort of systematic process for looking at body areas. So you need to be using your stuff, or you're not going to be using somebody else's. If you use your own stuff and it's complete, then you're going to be a lot happier with it. Anyway, so let's start off. Was there trauma or not? If there was trauma, are they able to walk on the heel? That is, get the heel in full contact and stand on it. If the answer is no, assume it's a fracture. If the answer is yes, you can do the calcaneal squeeze test, and I suggest transverse and longitudinal if you need to. If the answer is yes, then you've either got a really quite a small fracture, or you've got a stress or pathological fracture that's been finished off by the trauma. If there was no trauma, is the heel tender, the underside of the heel tender? If the answer to that is no, do the calcaneal squeeze test. And if that's positive, you're probably again looking at a fracture of some kind, stress or pathological, probably. If the answer to the squeeze test is negative, then you're going to have to really give some thought as to what's going on underneath. You may have to redo the exam, or at least review the entire exam, and you will probably need to get a second opinion. If it is tender, then you'll go down to look at the calcaneum. Can you palpate the calcaneum? If so, you've either got an atrophied fat pad or a spread fat pad. So you can do the squeeze test and then repalpate. So you transversely squeeze the fat pad together and then palpate through it. If all that comes together and you've eliminated the tenderness, then basically you've got a displaced fat pad. If this doesn't eliminate the tenderness, you're probably looking at fat pad atrophy. If the calcaneum is not palpable, then you've probably got an inflamed fat pad, in which case the fat pad squeeze test will be painful when you test it. That helps. I think that the main takeaway from here is worry about fractures before you worry about anything else. Stress fractures, pathological fractures, and overt fractures. So look at the level of trauma. Are they able to bear weight, in which case you've probably got an overt fracture, fire it out. No other test done. Certainly don't do the calcaneal squeeze test. It's contraindicated. If they can walk in it after large trauma and the squeeze test is positive now, it's probably a fracture, fire it out. And then trying to sort your way through fat pad problems is a matter of using the fat pad squeeze test. If the squeeze test is positive for pain, it's probably an inflamed fat pad. If you can palpate the calcaneum and you squeeze it together and you lose the tenderness of the calcaneum, it's displaced. If you can't get it, if that tenderness remains when you're pushing on when you squeeze it, then it's probably atrophied.